And famously, you hear this often that schizophrenia can be precipitated by some type of stressor at that time period in your life. People often talk about, if you have a genetic predisposition, say to schizophrenia, or it runs in your family, you should avoid psychedelics because they can trigger schizophrenia to emerge, or adolescent use of THC can trigger schizophrenia to emerge in someone with a predisposition. To what extent is that true, and what do we actually know there about these precipitating factors?
So we can think about precipitation in different ways. So let's talk about, on one side, substance-induced psychosis.
Mm-hmm.
That's a real thing. You see it with cannabis. You see it with hallucinogens, psychedelics. You see it with methamphetamine. And when you have substance-induced psychosis, there's usually three paths that happen after that.
And before you go on, so when you say substance-induced psychosis, are you talking about the onset of permanent schizophrenia, or do you mean the onset of a temporary and reversible psychotic
This is
state?
an acute psychotic state induced by substances, and that's where I'm going to get into what the potential outcomes are. In the first case, you actually do end up going from having an acute psychotic state to an organic psychotic disorder.
Mm-hmm. So an acute psychosis precipitated by drug use can sometimes turn into a long-lasting psychosis.
Yeah. The second one is that you stop using the drug completely and you never have a psychotic episode again. And that's where, there's some level of self-selection as well that happens. Right. And so even with cannabis, where most people will be like, well, I never experienced such a thing, or I've never had a psychotic episode, or I've never felt, even though THC is a psychotomimetic, people are like, I've never experienced such a thing. Well, it's because the person that tried it for the first time and had a bad trip never tried it again.
Yeah. The person who takes the edible and has a temporary acute psychotic-like state probably doesn't try it again.
Try it again, right? Yeah. So there's a selection bias that creeps in when people generally talk about this, right? And that's why nothing polarizes people more than cannabis, whether cannabis causes schizophrenia or not, whether it's a psychotomimetic or not.
Oh, I mean, I'm sure we'll get into this, but as someone who worked in the marijuana industry, I mean, this is just a huge issue. You've got